بسم الله والحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والعصر إن الإنسان في خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. May Allah make us among those who follow the orders of Allah subhanahu wa ta'ala and always advise each other with truth and with patience, inshallah. We are honored tonight to have Dr. Mahmoud Nouh, one of our beloved and first, let's say, one of the first attendees and one of the first, what do you call them, the founders of the Islamic Center of Father. And we are honored to have him and to talk about a very important topic, which is what our people are saying these days, which is about the vaccine. And we thought that this topic might be important because we heard a lot of misinformation and false things going around, false videos going around. And inshallah, Dr. Mahmoud, inshallah, he's one of the emergency doctors who was in the emergency room every single day. And he's facing this severe and strong virus every single day. So I think he's one of the most people or most knowledgeable people to talk about this subject. So without further ado, brother Dr. Mahmoud, inshallah, you can get started.
Thank you, brother Gawdat. Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala Sayyidina Muhammad. Khatam al-Anbiya'i wa Sayyid al-Mursaleen alayhi wa ala alihi wa ashabihi ajma'in. Rabbi ashrah li sadri wa yassir li amri wa hlul 'uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. The community of Hawthorne, and also joining us on Zoom, the community of Glendale, which is part of this beautiful mosque. Thank you, brother Gawdat, Dr. Gawdat, and the administration of Hawthorne allowing me to talk about a very important topic. Although I've been asked like more than 3 weeks ago, the topic is now very hot. Everywhere in the news, you can hear about the vaccine, about the corona, which is getting worse. I was in the hospital yesterday, and really things are getting worse. We have zero capacity ICUs, the ambulance waiting 2-3 hours in the hallway. People cannot get in because we have no beds upstairs. COVID, corona filled up most of our hospital beds and ICUs. So may Allah subhanahu wa ta'ala protect us from that disease pandemic, which you are seeing the light at the end of the tunnel with the vaccine, alhamdulillah, start rolling in. And inshallah, you and your loved one will get it soon. Let me just give you an idea. Ignorance is number one enemy. If you don't know what you are dealing with, you are going to hear a lot of fictions, a lot of noise, a lot of rumors. So I'll give you the facts so you be knowledgeable and know what exactly we are dealing with, vaccine-wise, disease-wise. All of us, we had vaccines actually knew little. When you were a child, your parents took you to the health department clinics. They gave you vaccine for poliomyelitis, for mumps, measles, diphtheria. Until nowadays, we're getting vaccines for shingles, for flu. And the vaccines that we've been used to get attenuated or weakened viruses or bacteria. They inject it to your body, and your body makes antibody against it. So when the real infection comes in, the antibody kills the virus and kills the bacteria right away. That's alhamdulillah, we don't have poliomyelitis, we don't have measles, we don't have smallpox and all the things. So it is not new to get a vaccine for the coronavirus. What's dangerous about the coronavirus, it's something new. It was discovered in 2019, that's why they call it COVID-19. COVID stands for corona, one of the virus for SARS and MRS and MERS, which some new mutation of a virus. All of us, the whole world doesn't have any immunity for it. And that's why people are getting sick. It's worse than the flu. The flu, at least you can get some infection, then you can heal. This one, killing people. We have millions of people infected around the world. Hundreds of thousands are dying. We have here in United States, every 40 seconds, one person is dying. In Southern California, like every hour or so, 2 people are dying. This is very serious. And unfortunately, the second wave is getting worse. So the vaccines, the scientists start working around the world in January. It started with Pfizer and Moderna. Pfizer company is a big company. They have many vaccines developed. They've been working on this technology for about 20 years. And they start working in January this year to find a way to fight this new coronavirus, which infect most of the people through respiratory droplets. If you are very close to somebody or around somebody, that's why people in big gathering, big weddings, only one gets infected, he infects everybody if they're not taking precautions, wearing masks, keeping social distancing, washing hands, and stay away from big crowd. That's why I'm sure many of our audience, which I like to hear from them, those who got the coronavirus, to tell us about their experience. When you get sick, some of them, you're a carrier, you show nothing, but you go to other people and you give it to them without knowing. And some of them, they get it mild, like flu, body ache, fever, chills, headache, nausea, vomiting. Some people, they get it sick, which you are getting in the ICU. It goes to the lung, it destroys the lung. It chokes you from inside. You cannot breathe. It gives you blood clots. You cannot breathe. And many people, unfortunately, succumb. So this vaccines, the new one, is something new. So we know that vaccines will be developed attenuated viruses or bacteria. It takes a long time actually to develop, many years to develop. And their antibodies to fight the disease also may be limited. And the new technology they developed, and instead of, well, this is the development in genetic engineering and in computing, the virus has spikes on it. And it enters the cell through like the mucous membrane or nose and the breathing and the lung. And it goes, and the immune body does not recognize right away. With the spikes, it attached to the cells of the body and it enters inside and instruct the cell to make more viruses. So all of a second, you have like millions and billions of viruses in your body. That's why many people, they get infected. Some people, they get sick after 2 days. Some people after 5 days. Some people after 7 days or 10 days. That's what is variable. And that's why people, when they get close to somebody, they go and test, and the test is positive in a few days. That's how bad the virus is. The body after that recognizes, oh, the virus is here, let's make antibody. It attacks ferociously the antibody and causes inflammation. And that's what causes most of the disease and the side effects. So the scientists find a way to find not the whole virus, but something like a fingerprint called mRNA. mRNA is like messenger RNA protein to preserve it and to give injection in the muscles, like I got mine yesterday. Alhamdulillah, very little sore, but nothing. And it goes on the cell, in the muscles here in the cell, and goes inside the cytoplasm itself and instructs to make some spikes similar, engineered in the lab to the one that's the actual coronavirus has. And when it makes that, the body realizes, oh, there are some spikes similar to the virus, and they start making their antibodies. So your body actually is manufacturing the antibodies against the virus when the real virus comes in. And the regular vaccination that we used to have used to be like 7-fold antibodies, and it takes a long time. This one, it takes more 7 to 20 folds antibody faster than when you get infected with the real virus. And that's why they tested 40,000 people with Pfizer, 30,000 Moderna, the new one that the FDA just approved yesterday. And the majority, all of them, they did not get the virus. Although they were exposed to the virus, alhamdulillah, they didn't get the virus. They tested them after that, they said, they found out it has to be taken again, the second dose. This first dose raises your immunity by about 50%. But we need the 95%. They found out after the 3 weeks, you take the second dose, and your body is going to go lose the immunity up to 95%. That's why for those who are going to take the first shot, inshallah, they give you a card. Keep your appointment, very important to take the second shot, which you may get some side effects. Does he give you side effects? Yes, like any vaccine. You may get side like fever, soreness. I have like 3 of my colleagues yesterday. Some of them, they got little headache, went away a few hours, take Tylenol. Some of them, they get body ache or fever or chills. That means the virus is really working, which is good for you. So when you have these symptoms, like when you have a child, you take him to the doctor, they give him the vaccine, and the mom comes with the baby, has a fever. Said, assure her, yes, that means the mumps and the measles virus, the polio, they are working good. So these are the kind of vaccine, which is new technology. We have, of course, some other countries they make, like the Chinese vaccine by Sinopharm and other companies. They have weakened the virus, inactivated the virus. In China, when I researched, they don't have enough people to try on them. That's why they are exporting this one to other countries. You have seen that in the news. And this one, we don't have a very good data to recommend it yet. The WHO wants all this data. WHO, by the way, by the end of this month, they are going to recommend Pfizer and Moderna. Because of the rapid need for that, people are dying from that. So the FDA and CDC, they approved like the rapid emergency approval for a vaccine that needed during the pandemic, because of the pandemic, because they found out the benefits outweigh the risks. And that will give you, they found out that when you get the real virus, people get like immunity for up to 90 days, because there are some cases reinfected again by the virus. So those are going to ask about the people who have the virus and the corona. Can they get the vaccine? They need to get the vaccine, because they are subjected to get the second virus again. And these are the, just give you like an idea. We give you an idea about what's COVID-19, discovered in 19, and what's Pfizer BioNTech vaccine I told you about. The other viruses, just to give you like an idea about the Sputnik virus, the Russian one, it's also part of the protein of the virus. They develop also, which is also not the same technology. And this is the same technology like the one in Oxford. But the new technology, the RNA messenger, which is a small protein developed in the lab. And the problem is that protein can dissolve quickly. That's why they have preservatives around it. And that's why they have to keep it minus 70 Celsius degree to preserve the protein from breaking down. They keep it in the sub-freezing temperature, like we said, special boxes, dry ice. And not all the hospitals, they have that. That's the Pfizer one, but the Moderna one can be kept like minus 7 Celsius, which has most freezers in many hospitals, they have that. And it has more shelf life, like about 30 days. Pfizer, about 5 days. Once you get it out from the freezer, they have to hold the room temperature, and they give it away. Very strict rules and train the people how to give it. And this is a difference I told you about the Chinese one, the Russian one, the British one. Pfizer has been started already the Pfizer one in England, and here about maybe 1.1 million today being distributed around the country. They are giving it in phases because the companies, they don't have enough yet. That's why the CDC, they developed the panel to give it who's the priority. Priority, of course, for the first people involved in incubation, like people like me in the emergency room, doctors, nurses, paramedics. And after that, there will be a second tier. After that will be like restaurant workers, teachers, people involved directly. And this will happen, inshallah, maybe by the beginning of the year. And by March to the summer, everybody else they are developing, the United States has now is going to have enough vaccine to vaccinate at least 70% of the people at least need to be vaccinated to make like a herd immunity, so prevent that. It's not mandatory, but it is highly recommended to take. And I'm going to pay for that? No, the government paid for that. It's free. If you remember when you were young or child and the government pay for that, it's free. What are the ingredients in the vaccine? We said it has many preservatives. You don't have to know about it, but it has to be preserved and in a very strict way. And what are the risks of the virus, of the injections? Of course, you can get pain, tiredness, headache, muscle ache, chills, joint pain, fever. We said all about that. Can you get serious? Yes, some cases, they have already bad allergic reaction from before. If you know that the case in Washington, and some people who get severe allergic reaction has to be EpiPen. The CDC, the FDA advised not to take it for now. And what should I do about the side effects? Bed rest, Tylenol, fluids, and that should go away. And what if I decide not to get the vaccine? So it's not being obligatory, but it's been recommended highly to get it whenever you can. Are there any other choices preventing the COVID side effects? There is no any approved alternative for now, except that vaccine. Can I receive the virus with other vaccines? Yes, you can still, the flu, can still get that. And if I'm pregnant or breastfeeding, can I get it? The CDC and the FDA, they recommend talk to your doctor and see, because it has not been studied extensively on pregnant or breastfeeding. So they don't want to recommend it now. Just talk to the doctor, and your doctor should decide. It depends on your circumstances. And the information will be kept with the whatever clinic too. Will the shot hurt or make me sick? As we talked about that. And is the vaccine safe for me? Yes, I'm sitting in front of you here. I got the vaccine yesterday. I got the second shot 3 weeks. So alhamdulillah, may Allah subhanahu wa ta'ala protect me and all of you from this one. Studies show that potential side effects, flu-like symptoms. How did they develop the vaccine so quickly? It is a new technology, genetic engineering with biomedical engineering and high electronic computers. They were able to manufacture that RNA in the lab, and they quickly multiply it in the lab. That's how they were able to make millions of doses in a very short time, which alhamdulillah is a miracle. The old vaccines, you must remember the polio and all these people used to die before they get the vaccine because it takes many years to develop. And this alhamdulillah developed in January. The CEO of the Pfizer said, I start to ordering on January to start work on it. And now we are at the end of the year, which is a miracle because it's a really very bad disease. Why should a vaccine be needed if I do other things like social distancing, wearing masks, prevent virus from cause? Yes, you may be able to be aware of that, but can you guarantee you cannot carrier and transmit to the loved ones? That's what you think. You have to think also about the other, not to be selfish. Get the vaccine whenever. Will I need to wear a mask after I get vaccinated? Yes, the same thing. You get vaccinated, I still wear my mask. And even though I have complete immunity after 3 weeks, I'll still do the same until everybody around you is not a serious candidate to get the coronavirus. Are there other vaccines that can help prevent from getting COVID-19? Flu vaccine will not prevent you from getting the COVID. So COVID is very separate. Is the vaccine mandatory? Not yet. It's not mandatory, but the government has that option if they found out not the majority took it, but now it's voluntary to take it. Which vaccine we are getting right now? Right now is Pfizer one, and the Moderna also via start will be shipping it also this week after it's been approved. What are the dates I'll be vaccinated? Communicate with your health professional or your health plan or your supervisor at work, if you're a teacher or restaurants. What's the best time to get vaccinated? Get vaccinated best before you go before you go days off. Like for example, I was working yesterday, I got it. Then today and next few days I'm off, and anticipating that. And can you get it also when you go to work? Yes, it is safe. You can get it, and just the symptoms, as I told you, very mild. What are pre-existing health conditions not recommended for taking the vaccine? We said those who are high risk. We said those who have elderly, like now with the nursing home, they are getting it. Those who have kidney disease, heart disease, immunocompatible disease, they have to take it. Those who will develop severe reactions, they are advised not to take it. They get allergic reaction. I heard that the vaccine temperature is sensitive. Yes, as we mentioned, it's very to preserve the integrity of the vaccine. It has to be in a sub-freezing temperature. And these are some of the questions. We mentioned why should I get vaccinated? And is it better to get natural immunity to COVID-19 rather taking the immunity of the vaccine? No. It is recommended you really get the vaccine. You don't want to try. I'm sure some of my audience did have the disease and how bad it is. Some people died. Some people got sick for a month or more. Some people get even side effects for the many weeks or months to come. And that's why don't rely on just getting the infection, no. It's important that you take the vaccine itself. Why do I need the 2 injections? We mentioned that. The first one gives you immunity up to 50%, and the second one giving up to 95%. That's why it's important really to take the 2 vaccines. And we mentioned the mechanism of action. And we mentioned that the emergency use authorization, EUA, by the Food and Drug Administration, which is badly needed. That's why they have to cut down the time of approval of the time because of the situation. And we mentioned the disease and its symptoms. And if you need more information about when you can get it, you can go online, California Immunization Information System, and CDPH about COVID ready, and that can give you on internet. There is a lot of resources. You can go online and get the information where and when you can get the vaccination. The Center for Disease Control also has a nice website. Their main website, COVID-19 vaccination, also can give you an idea. And those who have the infection, they appreciate now really how to get the vaccine and to prevent them from all this misery, which I heard about a lot of people. And our hearts really, may Allah subhanahu wa ta'ala be blessed to those who passed away. May Allah give them paradise and give their family support and condolences, because it's really, I know some families, some members died, some people got very sick, and it's still rampant overseas. I get called like, shall I take this vaccine? I give them the information like I'm giving you exactly right now. And right now, I'm sure I covered most of the things that goes to your mind. Should I get a vaccine? 100% yes, you get it. No matter what your condition is, you get it, except to those who I mentioned. And when can I get it? We mentioned that there are 3 tiers. FDA put the priorities, and inshallah, by the summer, they said most of the people, inshallah, will get vaccinated. And we have the next 5-10 minutes. If any questions, or those who experience the corona or their loved ones, they can give us some input to help support others. The question first from Hawthorne, then inshallah from Glendale.
دكتور نوح.
Yes, sir.
بعض الأخوات والأخوة يعني بيطلبوا يعني لو تدي دقائق بسيطة باللغة العربية على الحاجات المهمة نظرا لعدم فهمهم. نعم.
فيروس كورونا يعني لقوا مصل، احنا بنسميه مصل، في بعض البلاد بتسميه لقاح، بيسموه فصاده، احنا كنا بنسميه فصاده في مصر. المصل الجديد بتاع كورونا يعني مهم جدا، الكل لازم ياخده. الحوامل او اللي بيرضعهم يستنوا شويه او يسالوا الدكتور بتاعهم. It is not preventable, it's not recommended. It's يعني على حسب الوضع بتاع المرأة الحامل أو اللي بترضع، تقول للدكتور. اللي بيجي لهم حساسية شديدة من أدوية أو أكل ما ياخدوش الفاكسين دلوقتي. الفاكسين أمان 100% أمان، في بس أعراض بسيطة زي اللي بتيجي كل مرة. بننصح الجميع إن شاء الله إنه ياخدوا. الكورونا الوباء شديد جدا عندنا، المستشفيات دلوقتي زحمه جدا. يعني لسه انا جاي لي الرساله النهارده، عندهم زي طوارئ، زي كانك ايرثكويك. الاسعافات كلها في الطرق، مفيش، السراير كلها مليانه في المستشفى. بيسالوا دكاتره يشتغلوا فتره اطول، 12 ساعه واكثر. فكل واحد لازم ياخد الاحتياطات بتاعته. الاجازات جايه، انا عارف الناس كتير بتحب تسافر، ما حدش يسافر على قد ما يقدر الا بس لو حاجه ضروريه. تجمعات الزواج واعياد الميلاد والحاجات دي تجنبها. احتفل بس مع الناس اللي هم حواليك، اللي انت بقى لهم كذا اسبوع حواليك، العائله، الاصدقاء المقربين، عدد ما يكونش كبيره، 10 او اقل. وبرضه ياخدوا احتياطاتهم. واي حد عنده الاعراض يعزل نفسه. في جوامع النهارده ما فتحتش عشان الاستاف كله تقريبا جاله كورونا. في ناس لغت خطوبات عشان برضو اعراض الكورونا. في ناس عملوا افراح، وللاسف ناس كتير برضو عيب، ناس حديثا يعني. ف الرساله اللي عايز اوديها، المصل بتاع كورونا امان. بننصح كل واحد يقدر ياخده ان شاء الله، حسب الميعاد بتاعته، حسب الوظيفه بتاعتك، وحسب الهيلث. يعني الدكتور تتصل بالدكتور بتاعك او وزاره الصحه، او تروح اونلاين، هتعرف امتى تاخده. طبعا مش قبل اخر السنه دي، يعني على اول السنه، يناير فبراير مارس، في التير 2 اللي هم مثلا المدرسين بتوع المطاعم، الفاير ديبارتمنت، الحاجات دي. وبعد كده بدايه من مارس ابريل مايو لحد يونيو ان شاء الله الجميع هياخدوا. الشركات، شركه فايزر وشركه مادرونا بداوا بيعملوا حسب ما بيقدروا يطلعهم، وبيبعتهم الفاكسين وببلاش. ما فيش حد هيقول لك ادفع فلوس، الحكومه دافعه الثمن دوت، وبيبعتوه الحمد لله في العالم دلوقتي حسب الاحتياجات بعض الدول. وفي امصال ثانيه، المصل الصيني، المصل الروسي. ده منظمه الصحه العالميه ما بتنصحش دلوقتي لان ما فيش دراسات كافيه زي الدراسات بتاعت فايزر ومودرونا واللي هم هيوافقوا عليها على اخر السنه. اي سؤال دلوقتي عشان الوقت؟ لو حد عنده سؤال بخصوص العلاج.
جزاك الله خير دكتور محمود.
Yes.
Great information ما شاء الله.
Anybody wants to in Arabic or English, just ask me. I'll try inshallah to answer you.
إن شاء الله تعالى.